Welcome to Raise the Line with Osmosis.org, seeking solutions with leading experts on how to increase healthcare capacity so people can get the care they need during the COVID-19 crisis and beyond.
Hi, I'm Shiv Gaglani, and today on Raise the Line, I'm really privileged to welcome Omar Ishrak, who's one of the most influential figures in medical technology and healthcare in the US and globally. He earned that role in part by being chairman and CEO of Medtronic, the world's leading medical technology company, from 2011 to 2020, but he was also president and CEO of GE Healthcare Systems earlier in his career. Outside of healthcare, he serves as chairman of the board of directors at Intel and is also on the boards of the Cleveland Clinic and Asia Society. His tenure at Medtronic was marked by a focus on therapy innovation, globalization, and economic value, and he engineered the acquisition of Covidien, a $10 billion global manufacturer of surgical products and suppliers, the largest medical technology acquisition in the history of the industry. Over the last decade, he was responsible for bringing to market a long list of innovations to improve the lives of millions of patients around the world and help healthcare systems become more efficient. So Omar, thanks so much for taking the time to be with us today.
Great, thank you. Thank you for that very kind introduction, and I'm looking forward to the discussion.
So you obviously have a very impressive background in healthcare. Can you start by telling us a bit about how you got into engineering first and then the career within business?
Well, I got into engineering because I took a degree in electrical engineering, which, I just felt I wanted to do. And from that, I did a PhD actually in the area of ultrasound imaging. And that then took me into business. In the beginning, I wanted to do research, but very quickly, I realized that I wanted to know the impact that research would have on a product and then on patients and people and what value it would create for a company. And so that over time connected me with customers and with business, and that's how I eventually grew.
So you spent 9 years as chairman and CEO of Medtronic and retired just earlier this year in April 2020, as well as stepped down as chairman of the board recently. What can you tell us about Medtronic, how it's evolved, your time leading the company, any highlights that you can share with our audience?
Well, first, a little bit of perspective on Medtronic. It's a leading medical technology company with over 30 billion in revenue, 90,000 employees. But most importantly, we touch something like 70 to 80 million lives every year, people whose lives are impacted through the application of Medtronic technology and impacted in a way that it either extends their life or makes them recover from illness more quickly, or reduces their pain in some way. So that's what Medtronic really is. Now, in my time at Medtronic, really a number of things. The company has a storied history. It was formed in late 1950s by someone called Earl Bakken, who not only launched Medtronic, but essentially through that launched the entire medtech industry. One of the greatest things that he did, together with his leadership team very early in the history of Medtronic, is wrote this mission of Medtronic, which uses the words that we are basically a biomedical engineering company aiming to alleviate pain, restore health, or extend life for people. And that is just one tenet. There are actually 6 tenets of the mission. But what's very sort of appealing about this is that this mission not only inspires and unifies everyone in the company, which is quite a statement, because 90,000 employees, everybody at any time, anywhere in the world, you ask them what the mission is, they know what it is. And it's not just today, that's how it's been for 60 or 70 years. That's quite unique. Now, beyond that, the mission also guides us in terms of strategy, where we are and where we're not. We're biomedical engineering. We alleviate pain, restore health, and extend life. I mean, that actually says a lot. That means we change outcomes. And it also has, amongst the other tenets, a set of guiding principles, operational principles, which has in it things like valuing employees, valuing all employees, the importance of diversity and inclusion in its own words, the importance of being an important social citizen, the importance of making a fair profit. So, these are things that I certainly didn't create. All I did was follow them and maybe apply them to today's world. And it was always something that struck me, that this 6 statements written in 1960, when the company wasn't even making any money, had less than 1,000 employees, is as applicable today in 2020 as it was then, and I'm certain it'll be in the future. So my understanding of this mission and its application to the employee base, and hopefully, continue the legacy of my predecessors and make sure that it's a platform that can continue CEO after CEO, is perhaps the biggest thing. And then beyond that, the company is now, I'd say, on a growth trajectory based on a very robust product pipeline, which we had to invest in. It's a global company. And so sustainability of growth is maintained by global access. And I think it's a platform for the future, for future growth based on the mission and what we stand for. So that's basically my time at Medtronic. I think the only other thing I'd add is during this time, we also did the biggest acquisition in medtech, which was the acquisition of Covidien, which really almost doubled the size, the number, certainly doubled the number of employees and grew the revenue base by a significant amount. That was, like I said, a major acquisition, which has now been integrated and works very well with the rest of the company, primarily because we felt that acquisition would help us further the mission and touch more patients. That is what was most important. So that's like a bit of a summary of my time at Medtronic. And I could obviously go on, but those are perhaps the key highlights.
Well, that's pretty fascinating. I actually didn't realize that the same mission has lasted for over 50 years.
Yeah.
Medtronic is definitely a company that's inspired me on my own journey. I was a biomedical engineer in college. And then, as I mentioned before the interview, when I went to business school, I had an opportunity to learn from Bill George about leadership. And, he ran Medtronic as well. So it's definitely been a very exciting company to follow over the years, and especially how you've grown it over the past decade. So 2020 hit, COVID has changed everything. And we'd love to hear your take on, what are some of the things that COVID's revealed about our healthcare system? What are some of the lasting changes that you think will happen, both at Medtronic, but also in healthcare in general because of COVID?
The one thing that does come through is that COVID is essentially a crisis, and it's a global crisis. And if nothing else, it, in its own way, it focuses people and the healthcare system particularly. And things that have been striking is the speed with which remote care has been adopted for obvious reasons. And I think that'll stay. I don't know if it's still in exactly the same form, but aspects of it will shape and accelerate the usage of technology in healthcare, of that type of technology in healthcare. I think the other thing that also is very striking is, we've all heard about the vaccine and the speed with which that has been developed, also because of this very focused, crisis-oriented mentality, but also the therapeutics. And it's been remarkable to me how quickly the physician community, both in the US and around the world, began to understand how to treat this disease. At that time, all we could do is treat, and even now mostly. But the mortality rate has improved significantly since the whole pandemic first started. And it's been very striking how physicians have understood this, formulated policy, and shared it with each other. So that's in that area of treatment, I think that'll remain. I think if we can learn how to work together more closely in the delivery of care, and at least keep some of these items that become highlighted during a crisis, and at other times it kind of goes away, I think that would be really very beneficial. I think the other thing that also came out, and again, I don't know how to sustain it, but clearly when an event occurs that requires this overriding priority, then we learn how to cross company boundaries, we learn how to cross hospital boundaries, functional boundaries, and create solutions very quickly. If you could at least take some aspects of that and translate that into our normal operations, I think we'd benefit a lot from that.
Yeah, we've heard a lot about the speed at which traditionally slow institutions, healthcare, education, have changed because of COVID. We recently had Mike Alkire from Premier talking about the healthcare supply chain as well, and some of the ways hospitals have had to work together to allocate resources. I know Medtronic was a leader being tapped by the government earlier on to supply ventilators and upregulate production. You were on your way out in April 2020, but I imagine you probably were involved in a lot of some of those discussions.
Yeah, very much. Yes, I mean, certainly when the pandemic started, I was in the middle of this whole ventilator crisis, if you like, and Medtronic was in the middle of it. And I'm glad to say that we took a good leadership role. We were pragmatic about what could be done and what couldn't be done. One of the most important things we did is that we open sourced our ventilator platform, and that enabled some level of production around the world to happen pretty quickly. New business models actually were invented through that, and our own production went up rapidly. But equally importantly, in the early phases when the demand was so great that there was no way in which anyone could fulfill all of that demand in that time, we learned how to allocate. we learned, everyone almost in a panic wanted every ventilator there was, which clearly was not a practical situation. And so we had to first be very clear about our own motives, that saving lives was the most important priority. And wherever the need was the greatest, we would allocate accordingly. And so that forced us to create an allocation mechanism based on, say, the University of Washington models and look at it across the country and also globally and go through that process. And so I'd say that sort of focus on the importance of saving other people's lives and doing whatever has to be done to enable that, taught us a lot. And I think the company contributed in a way that, frankly, I'm pretty proud of. And I think we did make a difference, and we learned a lot as well. And we created relationships with countries, governments, other companies that I think will last into the long term.
Yeah, that's incredible. And, the reason we call this podcast Raise the Line, it was all about how do we increase healthcare capacity. And clearly the work, Medtronic was doing to do that, open sourcing your ventilators is a big part of how we were able to do that. So Osmosis is a teaching company. We have an audience of millions of current and future healthcare professionals, as well as patients and family members. And we love to fill in knowledge gaps as a result of this. Is there any topic that you would like us to develop and educate? Like if you could snap your fingers, have us build a course, what type of thing would you be interested in us building to educate either the clinicians or the public or both?
Well, let me touch on, two topics. First is, I'll go back to our mission and the importance of a sense of purpose in a company, which we talk about a lot. But remember, the Medtronic mission was written at a time in 1960 when people didn't talk about those things. But now we do, and it's appropriate and important. But, that sense of purpose must be something that has continuity, that has long-term sustainability. It cannot be like, every few years you write a new mission and form working groups, and then a few years later rewrite it. A sense of purpose defines a company's motive. Almost always that sense of purpose should relate to some kind of value creation somewhere, because after all, the company's being paid for something. They get revenue. And if you get revenue, you must be creating value. And understanding that linkage, I think is very important. That element of the importance of sense of purpose in teaching, in business schools and so on, I think is important. And it isn't something that you can just read up on. You can look at examples, but it's worth thinking about and considering and learning and questioning each other as to what kind of sense of purpose is one that is sustainable and what that stays over time, and that every company should really have that no matter what they do. And if you do that, then all the other elements that we talk about such a lot will follow. Everything from ESG metrics to why a company is worth a certain amount or charges for their goods a certain amount, all of that will follow from what the sense of purpose is and what value you're creating. So I think some kind of more formal material around that would be something that is probably valuable. And Medtronic mission, I think, could be an example of a sustained sense of purpose that's been adopted by 6 or 7 CEOs and maintained without any changes. And if I were to say one thing, is that the success of Medtronic over the course of decades has evolved in many ways from that singular sense of purpose. The other item that I think is worth talking about, although there's a lot of work in this area, but one that requires more and more highlighting is value-based healthcare. At some point, the healthcare industry overall, and I mean everyone, not just the technology companies, but also providers, payers, governments, patients, should look at value-based healthcare. Because in value-based healthcare, the fundamental principle is that you pay for an outcome, which sounds simple. And the difference between paying for an outcome and paying for the promise of reaching an outcome is actually profound. Because when you promise you'll reach an outcome and you get paid for it, you're actually not accountable for it. You've just made a promise. When you actually get paid for the outcome, you're accountable for it. And when you start to think about it that way, then you start to make connections with each other. And in that way, I think healthcare can be something of a growth driver, which it should be, as opposed to an economic burden, which is how governments and people think about it. But it shouldn't. Improving somebody's life, reducing the cost of care because unnecessary things aren't done. If you can imagine that those things help the economy, it becomes an economic growth driver. not one that's simply a cost burden. And I think that change is something that the world has to go to. And value-based healthcare principles have to be used to go there. And some sort of organized thinking around that, which is more scaled than it is today, I think is essential. There are a few organizations doing that, but it's not accepted everywhere. And I think to the degree that can be made broader and more organized, I think would help a lot. So those are two areas that I think are worth considering.
I would love to respond to both of those. I mean, the second one, value-based healthcare, we recently had Vivian Lee on our podcast, who wrote The Long Fix. She's president of Verily and used to be CEO of University of Utah Health Systems. In her book, she talks a lot about value-based healthcare, and I was shocked as to how little I was taught about this when I was a medical student at Johns Hopkins. Professionals, clinicians aren't being taught as much about how healthcare is paid for, but clearly, value-based is where things hopefully will be going. For the first one, on the sense of purpose, that is, a really important topic. And Medtronic's obviously been a leader here. Another leadership role I mentioned that you have is chairman of the board of Intel. And Andy Grove taught a ton of leadership lessons, including one that's we've quoted many times this year with the crisis of COVID, which is bad companies are destroyed by crisis, good companies survive them, and great companies are improved by them. So I imagine, whether it's Intel or Medtronic or hopefully some of the health systems, they will come out of this being even better because of the crises.
Indeed, yeah. And, Intel also has its own mission, which is not that dissimilar, except there it's using technology to make people's lives better, to make a difference in people's lives. So I think having a steady sense of purpose like that is pretty important for a company.
Absolutely. Well, I know we're coming up in time, so I had two last questions for you. The first is, given our audience is comprised primarily of students and early career health professionals, what's your advice to them about meeting the challenges of the COVID-19 moment and approaching their career in healthcare?
Well, we've talked about COVID-19 and the learnings from that, but I think focusing on patients, the role of the physicians and the people in the healthcare industry is to improve people's lives. One must never forget that the link to an outcome as opposed to an intermediate endpoint is important. When people talk about things like selling healthcare data and all this kind of stuff, which in my mind, is okay. One can create a business model like that, but the data alone doesn't do anything. It's the usage of the data to change an outcome that makes a difference in healthcare. So a line of sight to improving outcome, no matter what you do in healthcare, is important. That's one thing that I think people should always remember. Tie your work to how people's lives get better, no matter what you do. The other thing that is also important in healthcare is this notion of working together with others, but at the same time, recognizing that healthcare is a granular effort. A cardiologist cares about the heart, not the brain, they understand it, but nowhere near the focus as a neurosurgeon or a neuroscientist may have, or an orthopedist may have on joints. And the point is that in each one of those areas, one can build an entire career, not just being a physician, being a researcher. One can build an entire career just understanding some cellular mechanism in some portion of the body somewhere. And that's a life's work. And it's not something that's you just read somewhere. You have to actually work on these things. And so the granularity of healthcare is extremely important. Another way of saying that is and I'll take cardiology as an example because that's a nice, easy one to relate to. In the general public, a cardiologist is a cardiologist, but I think you and I both know that there's a massive difference between an electrophysiologist and an interventional cardiologist. And you don't want to go to an interventional cardiologist when you have a cardiac rhythm problem. Again, it's not that one is any more important than the other, but the fields are complex enough that it requires focus and understanding, and they keep growing. And so healthcare in the end is a granular area. You have to understand the details. You have to understand them in extreme depth. And you can build an entire career, an entire lifetime on just focusing on one thing. And, one should never forget that. Now, to scale things, you may need to add things together at a different level. I understand, and things can have side effects. You need to understand about other things. But what's really struck me is how focused really one has to be to really move the needle in healthcare. So these two things I would leave with the audience, that as they, sort of think about their careers in healthcare, can remember these.
I think that's great advice. And frankly, it's one of the reasons we even started Osmosis is that healthcare is different than other forms of education because it's way too vast. There's way too much information for any one person to know, which is why you have these specialists. It's high stakes. It affects people's lives directly. And then number three, it's dynamic. A year ago today, most people in the US probably didn't know what a coronavirus is. And now it's the only thing a lot of people talk about. And so because of those three reasons, we wanted to build a platform that was specifically designed for healthcare education. My last question to you is, is there anything else that we haven't covered that you'd like to be able to leave our audience with? Anything about your career or about your thoughts in healthcare? Anything else?
Well, I think we've covered more or less everything. Maybe the one thing that I will mention is to prospective engineering students who want to go into business. Engineering teaches you a lot of thinking processes. It teaches you structured thinking, cause and effect. It teaches you how to make approximations and trade-offs. And I think applying that to business can have a lot of value. Not only that, learning how to communicate any invention that you made or any bright idea that you may have in simple terms that your customers can understand is something that's worth spending time on. And I'd encourage engineers not to leave engineering, to keep their technical know-how, but don't be intimidated or think that business is not for you. Not because it's a different career, but because it's an extension of your own career and one through which you can create even more value and impact more people than if you simply did the engineering. So do both is the one thing that I would leave with the audience, or at least try to do both at least if you're interested. Don't be intimidated by it and go from there. But Shiv, thank you very much for your very engaging questions and for giving me the time to share these thoughts with you.
And Omar, thank you for not only being on the podcast, but more importantly, the work that you've done to raise the line and improve healthcare capacity. And with that, I'm Shiv Gaglani. Thank you to our audience for checking out today's show. And remember to do your part to flatten the curve and raise the line since we're all in this together. Take care.
For more information on how you can help raise the line and flatten the curve, go to osmosis.org/COVID-19. If you like this podcast, please share it on your social channels. You can also subscribe to the series and check out all of our podcasts at osmosis.org/raisethelines podcast.